medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
This is our final installment on Optimal Health 360 Degrees, a way to really be able to look at patients really from a total perspective. And now, since we've talked about what tests should be done and how to think through a particular case, as you can always go back and watch the other two installments, we're now going to talk about some of the things that we do to treat this and how to think through a treatment protocol. It may not be everything you have, but you need to begin bolting things together like a Lego set. Optimize cellular and mitochondrial function, as well as looking at the autonomic nervous system, reviewing endothelial damage, which means both macro and microvascular damage, nutrient deficiencies, viscosity issues, and most, of course, are hyperviscosity issues, inflammatory programs that you should be looking at, and oxidative stress. If you can look at those 7-8 things, you're going to be helping your patients beyond any way and anything anyone else will do. So start thinking, if there's genetic predisposition, focus on epigenomic interventions. If there's toxic metals identified that you've tested for, remove them with chelation. And certainly always use the word avoidance. Teach your patients how to limit further exposure. If it's a medication that's inducing some of the issues, prescribe a natural alternative while you're decreasing or stopping those other drugs, if possible. When there's inflammation and oxidative damage, identify the source, eliminate it, and use natural and, if necessary, medication to eliminate the inflammation. Of course, when lifestyle is not optimal, and never surely is for anybody, counsel diet, physical activity, stress, and sleep. If there's environmental issues, suggest pretty much the appropriate interventions. When there's hormone imbalance, optimize the hormone levels. If there's an infectious origin, well, treat that and minimize the exposure to that particular agent. And if there's an immune-mediated problem, support the immune system so it self-heals itself, which it does have that capability. Modulate the immune system if there's an autoimmune disease. And if there's physical or psychological trauma, after counseling and other appropriate interventions, you'll be able to help that individual. Well, we'll do one more installment after this, and that will be the treatment components and basically how to overlap these different treatments for the best results. For more information, go to Dr. Mitch Ghen, DrMitchGhen.com. And I hope you have a wonderful day and week. Thank you so much for watching.